I would like to invite our guest, which is the lovely Andrew Armitage from Greenside Regenerative Therapies, which happens to be where I work for too. Andy's just, I'm at work, and we're here to talk to you about something that we're really, really passionate about. So tonight's conversation is something that doesn't get talked about very much, but objectivity. Trying to make sure that our interventions, be it lifestyle change, be it medication, be it physiotherapy, be it regenerative, is actually working. So this is really quite an important topic. And I chose to invite Andy because he does a lot of objective measurement. We've already got a few people saying hello. Hello, Andy from Lynn Hancock. Hey, Lynn. So, Andy, let's get the ball rolling. Let's talk about what you do. Otherwise, I take all the airspace. Please run through with people what happens at your practice when people bring their cases to see you and why it's important.
Okay, so we obviously start with a veterinary physical exam, but we also need extra information on weight distribution in the limb, on at home, muscle mass measurements, and measurements of their quality of life. So it's very difficult to sort of gain all of that information by just asking the owner questions. So we have a lot of tools that we use to get that information. But the main things that we use is a stance analyzer. So this is a pressure plate that the hands on, and that measures the weight distribution in all four legs. So this gives us a very quick and easy way to measure weight distribution. So a normal dog would take 60% on the front legs, 40% on the back. So we should have 30, 30, 20, 20. If there's pain or dysfunction in the limb, then they're not going to want to put that amount of weight through one particular limb or multiple limbs. So they, what we call offload, so they don't put the full weight through that. And we can pick that up on our pressure plate. So that is one way of identifying, which limb or limbs are affected. Because, we can watch gait, we can watch a dog walk or trot. Sometimes it can be very difficult to see which leg is lame, and especially if you've got multiple limbs affected, it can be difficult to work out, what's the worst, or even which limb is causing a problem. And that's particularly so if we've got back end as well as four limb problems. So, and
can I just butt in there? This is quite important. There was a study where they looked at a very high up surgeon, so like a diploma holder, then a certificate holding surgeon, and then just a resident, and they got them to score lameness. So these are all people that are trained to identify lameness. And they found that actually the resident was more accurate at detecting the degree of lameness compared to the most accurate tool that we have, which is a pressure, a force plate analysis. And I just find that chuckling, really, because it makes us realize that even watching the dog walk is very open to subjective interpretation, isn't it? So that's why you these tools to get more figures to it that can't really be disputed so much, isn't it?
Yes, definitely. So, I struggle sometimes, watching an animal walk and trying to identify exactly what's going on. These tools, really help and gives us a quantifiable sort of figure to put on the amount of weight that's going through a limb. We also have another similar device, but it measures similar things, but it's a treadmill with pressure sensors in it, and when the animal is on, it measures weight distribution again, going through each four limbs, and also looks at stride length as well, the amount of distance that each limb is taking. So gives us some similar information to the start, but it's what's happening when the animal's in motion. And that can be different, certainly with soft tissue injuries, muscle, tendon injuries. Some of those only come into play when the animal's in motion and not engaging that muscle or tendon, then that may not cause offloading. So it gives us two different sets of data, one during motion and one whilst just standing, and we use those together to form a picture of where the problem lies.
And just to butt in again, now that I'm working with Andy, it's quite common for us to have a dog that once you put it on the stance analysis, which is a mat about the same size as the weighing scales, about the same depth as the weighing scales, and you ask the dog to stand with one paw in each quadrant, and you're trying to get them to stand in a very neutral position, and you take numerous readings, and then you take an average. You can have a dog that doesn't look too bad on that, and then you put them on the gait analysis, and oh my goodness, they look terrible. So using your two different ways of being objective, as you say, you get the more information about what weight they're happy to bear when standing and what weight they're happy to bear when moving, and it can give you very, very different results. What else do you do? So when they actually come into your clinic room, there's other things that you do as well.
Yeah, so obviously we do a physical examination, and that involves palpation, but we also do a lot of measurements of what's called goniometry, which is joint angles. So we measure the extension angles and the flexion of each joint, and we know what normal is, and we can compare that to normal, so we can see if there's any restrictions to that range of motion very easily with, it's basically, well, have you got it there, Hannah? Next.
Oh, I have. Check what I've got. I am. So this is called a goniometer. And this answers what Lynn was just talking about. Some of these tools aren't available in first opinion practice. No, you're right. What we're doing today is I'm going to just run through all of the things that are kind of available to yes, your more focused practice, but then me and Andy are going to step back in time and start talking about first opinion and things that he feels that we can incorporate into first opinion practice. This is a goniometry. So, when we've got, oh God, I can't do it. This is kind of hilarious. Let's do my this is terrible. So you can measure the actual joint range. That's really terrible. I can't. Finger. There you go. So you can actually measure the angle in full extension, and then when I flex my finger, we can do. Oh, terrible. I should have practiced. But full extension, flexion, and when a joint has arthritis, be it because of pain and they don't want to flex and extend it because it's so painful, or because of remodeling to the joint capsule of the bone, it won't be able to flex and extend to its full range. And if your therapy is working, you might get improvements in that. So that's a very, very good tool. I've also got this. Not many people know that.
So just going back to the goniometry, it's £2 on Amazon. It's very, very cheap and easy to do. So yeah, I use that a lot, and I measure all the joints and look at range, and if you've got restriction to range of motion, we have to work out whether pain's causing that, whether it's a pain response that the animal's not letting you fully flex that joint, or whether there's a mechanical obstruction, so new bulges in the joint capsule or contracture in the muscle, that's causing that. So that gives us a lot of information, and we know what's normal. And as you say, we can, if we're doing physiotherapy, hydrotherapy, where we're trying to increase range, we can measure the responses very easily. So goniometry, and
just to make all the cam followers laugh, Andy is actually only about 5 miles up the road and at home, but he sounds like he's in Uganda because of the I find this hilarious. I speak to people in America easier than this.
I know my broadband speeds are very slow at my house, and
okay,
quality, I'm afraid.
Let's talk about this one.
So at the top, there's a rubber projection, and that goes into the device, and it measures the amount of pressure over a particular area. So we can put that that rubber prong on an area of the body and push, and the machine measures the amount of pressure applied over there in pounds per square inch. So the harder we push, the higher the. So I use this a lot for disease, spinal pain, and we validated it for that use. So
how much are these?
Yeah, 350 quid.
Okay, so not too bad. I'm just going to go and get the other piece of equipment. It's by reception. 2 seconds.
Okay. So the pain algometer, we put pressure over an area until the animal reacts to that. So we use that a lot at the lumbosacral junction, when it meets the sacrum, the lower back, and we can apply pressure there until, and we do this with the animal standing. And I put my hand under their abdomen, under their belly, and we just apply force, increasing that until we get a reaction. And that reaction may be turning of the head, licking of the lips, but more often than not, the animal drops them, so they try and go away from the pressure. And at that point, we take the reading, and we do that 3 or 4 times and get an average. For things like lumbosacral disease, a normal dog should be able to put at least 14 pounds per square inch of pressure on that site before you get a reaction. Certainly anything less than 10 is abnormal, and signifies an increased sensitivity to discomfort there. So that's one way of quantifying a pain response through palpation, basically.
Yeah, and that's what it's quite important to get these black and white figures, and we're going to come back to it and have a discussion in a bit. So all of you people that are going, what is it about tonight? We're just going through different pieces of kit, from expensive to quite affordable, very affordable. But we're also going to talk about this one, and then we're going to talk about the pros and cons. So this little jobby is actually ridiculously expensive for what it is. How much are these? They're about 60 quid?
They're about 60, 70 pounds. They're a plastic tape measure, but the expensive bit is the dangly bit on the bottom.
So anybody start a new trade and undercut 60 quid, you're in a winner here. So what's this do, Andy?
So what's called a Gulick tape measure. So it is a tape measure that's inelastic. So it's we can wrap it around a limb. It doesn't stretch, so the tape measure is rigid in that respect. And then we have a little gauge on the end, as the hand now. So we can wrap that tape measure around a limb at specific points, and we can measure the muscle diameter. And we can measure left and right and compare, see if there's muscle atrophy or too much muscle in a limb, and it gives us an idea of symmetry. Now, a problem with just a measure, so we can all get a tape measure for 3 quid, and same thing with the tape measure. You're wrapping it round the circumference of the limb, and you're tensioning that tape to get a reading. How much do you put on that tape? Take the reading, because all soft tissues are compressible. So if I put that tape around my arm and get to end, get smaller and smaller until you've completely compressed those soft tissues, and in our patient's fur as well is very compressible. So we need a way of measuring a constant tension to that tape to give us consistent and repeatable and reliable results, and results that can be repeated not just by myself but others as well.
And so that
tensioning,
continue, sorry.
Yeah, so that gauge, as you apply tension, it clicks into place, and when it clicks, that's the appropriate amount of tension to apply, and then of the diameter of the muscle.
Yeah, and this is really interesting because I've only just started working up in Greenside. I've been up here now for about 5-6 months, and using especially these pieces of kit, there is variation between me and Andy. So however much we try and work as a team, if I was to see his case and see whether it's improving or deteriorating, I might put a little bit more or a little bit less when trying to get joint angle measurements. We try and reduce the variability as much as possible, but everything that we do is never 100% perfect. So that's why Andy takes lots of readings. So that's why he has the gait analysis, the stance analysis, the algometry, the goniometry, the Gulick tape measurement, his palpation, musculoskeletal ultrasound, x-rays, etc. So now what I wanted to do is, now that we've warmed Andy up and he feels like he's got airspace against Gobby Hannah, is I wanted to talk about going back in time and being in first opinion practice, because it wasn't long ago that I was in first opinion practice, and trying to get owners to help you work out whether a case is improving or deteriorating. It's very, very difficult. Now, why is this important? We're just going to stop and pause and talk about why it's important. I'm going to give you an example. Holly's Army recently has featured quite a few people talking about using non-steroidals as and when they need it. And that makes me a little prickly, because we know that we're very poor at detecting pain and we're very poor at monitoring pain. We know this, it's proven. So when people say I use medication as and when I need it, I sit there and feel a little bit uncomfortable, because how good is that owner's skills at detecting whether that dog is in pain or not in pain? How do you feel about that, Andy? Because you have quite a lot of dogs that walk in and they look not too bad, and it's once you start palpating them, you start finding problems. How do you feel about owners being able to pick up on pain? What's your feelings?
It is very difficult because dogs hide a lot of discomfort and don't obviously show it. There can be some indicators that owners are very aware of, but I think there's a lot of indicators that owners don't pick up on, and a lot of people say, oh, they're just slowing down, and not really thinking what's the cause of that. And for us as well, before we start poking and prodding them, it is difficult to assess the amount of pain that they're in, because they will, especially in pain, adapt to that, but it doesn't mean that they're not still feeling it. And it's really trying to work out how that animal feels, how its quality of life is, and that's very difficult for us as vets as well as owners.
So the reason that I wanted to do about objective monitoring was actually a little bit of an indirect prompt for people that choose to use therapies maybe as and when. Make sure that you're being accurate. So all you Holly's Army followers out there who are watching this, please, when you say my dog, I only medicate them as and when they need it, especially if your vet has prescribed you a long-term medication and they've suggested to you that your dog is sore, try and get some objective measures so that you can make sure if that medication is actually needed, you get it in there, okay? And just a little plug on that. For all those ones that do use non-steroidals as and when, we do know that they're less effective. So if you've got a dog that has got reasonably progressed arthritis, non-steroidals are known to be more effective if they're used on a regular basis for a longer term. So the longer they've had uncontrolled discomfort, pain, whatever you want to call it, the longer they're going to require to be on a course for. So this is why objective monitoring is the topic of conversation today. Going back to your consult room, Andy, so you've had somebody come in and they didn't realise that their dog was in so much discomfort. How would you have probably picked that up on your clinical exam? What kind of things do you do? So the dog's actually walked in, it's been wagging its tail, it's wiggling from the waistline, and then you start doing your clinical exam. Tell them what you do in your objective clinical examination so owners can know what to expect.
So I always start at the head end and work to the tail, and is palpating all areas of the body. We're checking for joint range of motion. We're feeling how the muscles feel, how the soft tissues feel, whether there's resistance to flexion or extension of the joints. We can feel if there's any muscle spasm. We're feeling for symmetry. There is muscle loss on one side more so than the other. Is there, and we're palpating all these structures. So palpating is just applying pressure to different areas of the body and feeling how that tissue feels, but also is there a response from the animal whilst doing that? And that can give us areas of concern that would, we may need to do further diagnostics to actually tell what's going on. But we're just trying to identify the specific part of the body and whether that's deeper into the joint or whether it's more soft tissue. So we put each joint through its range of motion. We look for bony swellings. We look for swellings in coming from the what's called a joint effusion. So if a joint is unhappy and particularly inflamed, it will produce more joint fluid to try and lubricate the surfaces. And that swelling of the joint capsule. So every joint in the body is surrounded by a fibrous bag, and which contains the joint fluid, and we can feel whether we've got outpouching of the joint capsule. Not in all joints. Some joints like the hip, you can't that whether there's a joint effusion, but elbows and wrists, carpi, it's very easy to palpate whether there's a joint effusion or not. And then, once I examine the limbs and the joints and would pay particular attention to the spine, we see a lot of dogs with spinal problems, and these are cases don't always show up to the owner that there's a problem, because a lot of these dogs with back pain are not lame, so they're not obviously limping and showing signs of discomfort. It can just be some stiffness. Maybe they don't want to jump into the car anymore. So we palpate down the spine, press on each of the what's called dorsal spinous processes, which are the bony prominences coming from the top of the spine. If there's any areas of discomfort, feeling again for any changes in the soft tissues, any muscle spasms or pain. Muscle spasm, when you feel the muscles, they should feel like a rare fillet steak, nice and squidgy. If they're muscles are hard and there could be a pain response. So we just get
and
a lot of information.
If you're vegan like me, they feel like a ripe tomato.
Yeah.
People go, I don't want to feel meat, Andy.
Sorry, I'm not being inclusive.
You're not being inclusive.
So we'll work down to the back legs. Another test that I like to do is tail hyperextension or elevation, so lifting the tail up, and see if we can flex that tail up. I can demonstrate. I've got a cat here on my lap. So lift the tail up and flex it over, and the tail is connected to the sacrum, obviously, and we see a lot of lumbosacral disease problems at the lower spine. And when you elevate the tail, it rocks the sacrum and can pinch that lumbosacral junction. So that can be a good test of whether there's lumbosacral discomfort. Again, a lot of dogs can react when you do that because they think you're going to stick a
thermometer
on something like that.
Yeah. So just to kind of like, hopefully this first like 20 minutes, we've kind of talked to you about the tools that are available, and this probably is quite a, oh my God, I didn't realize there's so many ways that we can be objective, because it was for me. Even though I went to university at a similar time to Andy, a bit younger, I didn't have this kind of training at university, and the practice that I worked in earlier in my career, I didn't have these tools. They weren't highlighted to me as important, etc. But they are available. So for any of you practitioners out there that want to know more, then please do just get in touch, because being objective is really, really important when we're trying to work out whether our intervention is working, whether that be you being on an anti-inflammatory, whether that be you're adding adjunct medication, whether you've had surgery for a joint problem, whether you've had regenerative medicine, whether you've done laser, whether you're doing hydro. All of these things, for one reason, we need to make sure it's working for the dog. And this is the priority. CAM's mantra is this is about the dog. So we need to know that it's working for the dog. We need to make sure it's not making the dog worse. That's a really key point. We need to make sure your investment is well spent, because I know I don't have a money tree, and it gets extraordinarily expensive trying to manage these cases long term. So I want to know that my monthly outgoings is for the best of my dog. I also, something that I wrote in the description is, I don't want to be telling people things work when they're not actually working. Now, having spent a little bit talking about these objective measuring capabilities within a practice such as this, we know that they're not readily available in first opinion practices, but the stance analysis could be, the goniometry could be, the algometry, the muscle measurements, the palpation skills can be. However, we have a problem. First opinion practice is very time constricted, isn't it, Andy? And if you go time and remember when you were doing first opinion work, what do you think that you would have been capable of doing in a first opinion consult? And let's bear in mind, most of the people that follow CAM see first opinion vets. What kind of things can they expect from a first opinion consult?
It's difficult because, my consults are an hour long, and even that's too short, because you've got a history, you've got to take, what's happening at home, what's happening with the dog. A history can take a long time, just questioning to get a decent picture of potential problems, and then all of my tools that takes a long time to measure all the joints and things like that. So that is restricted by time, and with first opinion you've got 10, 15 consultations if you're lucky. So basically you have to be quick. So the history, you're going to ask pertinent questions. You can get to take a full in-depth history covering all aspects of the dog's life. So you kind of pick and choose and adapt depending on what the problem is. And you've got to get a physical examination done, and then you prescribe medications or treatment options. You've got to discuss those treatment options, potential side effects or prognosis of treatment routes, and it's a lot to fit in that very short period of time. So I think what would be good would be owner questionnaires that they can fill in this information and have that in a very short way, so that we can, you know, take out the points of interest in that questionnaire before the consult. So it becomes part of the history. When we're reading, before we bring in an animal, we read the clinical history, see what's happened to the dog in the past, if it's got any medical conditions, drug sensitivities, things like that. A questionnaire that covered what's happening at home would be very, very useful. And
I did
some
not
people bring in diet.
I didn't really prime you. You got there with logic, and that's what I was trying to do. I was trying to get you to kind of say that this is a difficulty in the vet industry. It is nobody's fault. The system of 10 to 15-minute appointments have been in place for eternity. I believe it originally stems from optician appointment structure, is what the veterinary consult system comes from. But there are diseases, these
well,
what?
Doctor consults around 10 minutes as well.
Yeah, you know? It's really difficult to do chronic disease like this in such a short space of time, but there is an answer. So all of you people that were watching this and going, oh, well, my vet doesn't have the time to do that and it's too stressed. You actually can provide us with so much information. Yes, these are very, very useful and they're very, very important, but actually you filling in questionnaires and what are called clinical metrology instruments or health-related quality of life instruments is so valuable when you go to your vet. So Christina, who's talking about her aggressive dog and how it's really difficult for her to get the best out of her appointments. There is a little bit of an answer to this for you. So there's numerous tools out there, and I'm going to, after this live is finished, list all of the links for you so you can go and look at them for yourself. Most of them are paper-based, so you can print them off and you can start using them so you can be honest with yourself about improvement and deterioration. Now, a lot of the tools are divided into emotional states and enjoyment and capacity to enjoy living. And they also have components about capability. So they are very cleverly constructed. None of them are perfect. Some are a bit more labor intensive than others. But they are very, very useful. And the profession knows that getting the owner's overall understanding of how their dog is doing is priceless, isn't it, Andy? You rely on owners giving you good feedback, but you have to educate them before they can give you feedback. You have to teach them about the disease, how it can be difficult to monitor, look for the subtle signs before that information is useful in many ways, isn't it?
Yes, definitely.
Yeah.
But there's so many of these questionnaires, and they're all slightly different, but they're designed for owners to fill in, so that they are quite quick and simple, and they gives us a score basically that we can follow and mark, and it just it saves a lot of time in the consult. But again, they're not foolproof.
They're not foolproof. So tell them about the one that you use. I love Miss Professor Jackie Reed. She's a little bit of a gem. Just tell them about Vetmetrica and why you chose that one.
So Vetmetrica is a health-related quality of life questionnaire, and it's a bit different to the other one. So I used to use what's called the Canine Brief Pain Inventory and the Load one, which was the one by Liverpool looking at arthritic conditions. And what I found with the CBPI and the Load was that it was very difficult. You know, I'd hand these questionnaires out, they were paper-based, and the owners would forget to bring them in, or they wouldn't post them in, and sometimes they wouldn't complete them either, which results in these questionnaires are designed that you have to answer every single question. And if you just leave one question out, then that invalidates the whole questionnaire. So those questionnaires were good, and they gave you an indication of pain, really, with the canine brief pain inventory. But the load developed on from that was scoring pain, but also it was looking about how the animal was as well, which gives you clues. So I use these a lot, but I found a lot of problem, and getting them to be completed and returned was a big problem. I was looking for something different, and when that Metrica was developed and made available by Jackie Reed, this seemed to tick all the boxes. So this is an online questionnaire, and it's done online. So each question, you can't see what the next question is, and you can't progress to the next question until you've answered the preceding question. So you can't complete the questionnaire unless you answer all the questions. It's your complete data set and validates the questionnaire. And it looks at 4 different domains, basically. All the questions are designed to give a score in different parts of the animal's life and well-being. So we get a score for happy and content, comfortable, energetic and enthusiastic, and I forget the line. But there's 4 domains.
Fucking late. But the good thing about it is, and a lot of people, and Helen has just put this, so Helen Bishop, well done, you've done your homework. This tool has been shown to be more reliable, being digital based. You can't go back and look at your previous answers. And something that is simple is that they ask you the same question kind of twice, but in different wording, and you can't what you wrote before, so you can't fudge your results. Now, I know that I fudged Holly's results. I didn't want to be honest with myself at the end, and I would try and tweak things so they didn't look as bad as they really were. And the paper-based tools allows you to go and look at your average trend, and you can kind of move things around a little bit. So that metric, it is clever. And also, I didn't realize that you can divide it into 2 sections. So you can take the capability out, and you can do it more on the emotional side of things. So if you've got, dogs that really do have quite strong disabilities that aren't going to change, but you can look at their emotional state of happiness separate, which I was quite
quality of life, how that animal feels, which is different to a lot of the other pain-related questionnaires. Which is very, because a dog may have a mechanical lameness, it may have a fused elbow, so it can't bend its elbow. It's not in pain, but it has a real bad it can look, but it's mechanical, it's not painful. So scoring a limp.
Well, and then for me, because I am queen of, and what's the sentence? Minimizing aggravating factors is what I've realized the appropriate terminology is. Whereas I'm just going to stop them falling over, for God's sake. Minimizing aggravating factors, we don't want them jumping out of cars and going up and down stairs. And some of the questionnaires do include that. Now, I can understand why they include it. But for me, I'm trying to tell people not to do it, because why ask a dog that's debilitated to do something that could result in harm? So to recap about these questionnaires, I am going to list them after this live. They're all going to be there. I'm going to do a little bit summary about all of them. They've all got their strengths and weaknesses, but we do know that they can really change the way that we manage this disease. And considering there's about, I think, 8,000 practices in the UK, I've worked in probably 50. I have never used them in small animal practice, because you rely on the owner participating. The owner has to be on board. The owner has to contribute. So what I will quickly tell you about something that I've done, especially in practices where they don't have a protocol established, is use something called client-specific outcome measures. And that's part of the Cincinnati Orthopedic Index. It's a lot of work from Duncan Lascelles has been done on client-specific outcome measures, CSOMs for short. And that's basically where an owner chooses the change that they want to monitor. So let me quickly run through with you what Holly's was. So Holly actually walked in for, sadly, her last visit to the vet. She could still walk. She hadn't collapsed, but her emotional state, her coping strategies had gone. So for me, she was a very emotional dog. So she just didn't want to interact so much, whereas she used to greet me. She would have her ears back a lot rather than being pricked up and, yeah, what's going on? What's happening around me? She had pain in her neck. So instead of her turning around to look at me, she'd turn with the whites of her eyes. I could tell that her back was sore because she'd be arched in her back. She wouldn't be flat backed. She had lumbosacral disease, like what Andy was talking about. So she'd have a dropped tail, but when she was having a good day, it'd be wagging and it'd be back up to normal. And a real giveaway for me was that she would have quite difficulty getting up into a stand. She'd pull herself up into a stand because she was very weak in her back legs towards the end. And when she walked, if she was having a good day, she'd stride. But when she was having a bad day, she'd whisk. So they were my client-specific outcome measures. I had 5 or 6 that I observed, and I could see when they improved and they deteriorated. And I could take a summation of all of them. I started off having them written down, and this tool is available on the CAM website for you. I'll also do the link. Originally, I wrote them down so I could memorize them and I could monitor whether I was seeing improvement and deterioration. But eventually, they were up there, and I began to be able to read her better. Now, being objective like that is really important because we're now going to tangent and talk about something that we all suffer from. Me and Andy will suffer from it. Caregiver placebo. Do you want to take it away, Andy? Because it's pretty prolific.
Yeah, well, it's if we're providing a treatment for an animal, or we're giving a treatment to an animal, we want it to work. So there's this placebo effect. With the caregiver, it's you're expecting a response and you're a response when there may not be a response there. And it happens as well. If I'm providing treatment, I want that animal to get better. So the next time that they come in, is it better? Because you're hoping for it to get better, it can skew your actual, interpretation of whether it has. And it's a big problem, and it's a big problem in research, as well as in a normal clinical setting. And it's difficult to get around this. And the more invasive the treatment option, or the more expensive, the more money that you invest in it, the bigger response you're going to want to see, and you do see, even though that effect may not be there. Yeah,
and that is the big truth. So let's just quickly talk through why this can happen. But first of all, I'm going to give you some scary figures. So they did a drug trial, and there was a placebo arm in the drug trial. And the placebo arm showed that 57% of owners saw improvement in their dogs, even though when the dogs were put on objective monitoring, such as force plate analysis, there was no change. So that's a really high figure of people believing that there was an improvement. They might have seen improvement in their dog emotionally, but physically, the dog's capability did not change. But what was really scary is that the vets in charge of the study, who didn't know which ones were on placebo and which ones were on the drug, 45% of vets saw improvement in the dogs that were on placebo because they were heavily influenced by what the owners were telling them. And that is the truth, that when I have somebody come into my small little consult room, no air, no windows, electric light, tiny little prison room that they are, we're relying on you, the owner, to tell us how your dog is doing. Time is short. We trust your judgment. Now, if you've come in and you're desperately wanting your 12-year-old Cocker Spaniel that's been having a bit of a bad time to have shown improvement because you had a new supplement that you bought or a new drug was prescribed, we're going to listen to you. So we need all of us to work as a team to be more objective, because the truth is that dog's going, hey guys, nothing's changed. I really, really want some help down here. You know, that magnetic coat that you just bought me has done toffee all. I need some help. So for the dog, we need to be more objective. So we have the tools that Andy talked about at the beginning. They are available, and any practitioner or hydrotherapy, we've got one guy from a hydrotherapy centre called Lee France, the stance analyzers, yes, the one that we have here are from Companion, and I'd love to tell you that if you mention CAM, they will donate money to CAM for if a practice chooses to buy one. So just remember that. So we do have these tools. We have our hands. We have cheaper tools that you can pick up from Amazon. We have these questionnaires that are freely available for you to download off the internet, and I'll put the links below. Together, we need to be more objective, because at the end of the day, we have got a great toolbox of things that we can use, but we need to be able to use them wisely. And coming into the vet and going, yeah, I think he's better, has got to go. We've got to be more objective about this. And this whole episode was stimulated because of people saying that they were using these anti-inflammatories as and when. And in the same day, I had seen a number of dogs that walked in, tails wagging, but when Andy started assessing them, they really were very, very painful. So for the sake of the dogs, we need to be more objective. What other things were we going to talk about? I think that's about it, wasn't it?
I think that was, pretty much covered. Questionnaire. The question is into more depth. I think one thing is they are readily available, and you can download these, and it's something you don't have to be requested to do. You can do these yourselves and bring them in. Another helpful thing is videoing your dog doing specific tasks. Yes. As well as a measure. How do they get up after rest? And how do they do stairs and back of cars? And that.
You're already 4 miles away. It's embarrassing.
I'm not Uganda, but can be helpful an owner to look back on as well and see what the animal was doing a month ago, 6 months ago, last week, and yes, comparing what they're doing to that is another tool that you can put outcome measures.
Okay.
So,
well, because it sounds like your internet is seriously taking the mickey out of you at the moment, you've still got to do 10 top tips, okay? And I don't know if you've seen, we do this on the other lives. So we take it in turns. You're going to start with number 10. I do number 9, number 8, number 7. I never remember where we've got to. I always get it wrong at the end. But they've got to be tips that are applicable to everybody, no matter your financial capabilities, no matter your physical capabilities, doesn't matter what country you're in. These are things that you have learned do make a big difference to that owner. So I'm going to let you take it away, Andy. Number 10.
So we're not talking about outcome measures anymore.
No, we're kind of coming to an end because your internet is seriously dying.
Right.
Oh, it's gone. It's totally gone. Okay, so it's just me. His internet was failing. So anyway, guys, thank you very much for joining us. It's quite funny that Andy is actually only about 5 miles up the road, and I felt like I was talking to him from Kazakhstan. 10 top tips. I'm going to run through these, and I'm sure Andy will agree with me. He might just join me again. Number 10, I think the most important thing to take home from tonight, I'm sorry the reception was a bit poor, we need to be more objective. Something that I am really passionate about is peer-to-peer learning, and Holly's Army really does do that for us. We have adults who are teaching other adults of things that they have found that work for them, that hasn't worked for them. But whenever we are giving people advice, we need to make sure that what we're doing actually did work for our dog. So we need to all be objective. So don't start saying, yeah, I bought something and it was really good for my dog, when you don't actually know. So be objective. And the cheapest, simplest way is the CSOMs, client-specific outcome measures. But as I say, I'm going to put a long list of these questionnaires that often give you a numerical figure at the end that you can trace. You can also sign up for Vetmetrica, which is the digital-based tool, but be objective, because the last thing that you want to be doing is spending lots and lots of money on interventions that aren't making a blind bit of difference. That's number 10. Please be objective. Number 9 for me definitely has to be weight control. Again, it's another no-brainer. It's free. It's accessible. It isn't just going to help your dog's pain state and arthritis. It's going to be good for them in total. It's linked to many, many other comorbidities. So getting your dog to the right body weight is absolutely imperative. I regularly, daily, see dogs that owners believe are the right weight, and they really, really are not. So my tip for number 9 is that you need to get somebody else to be cruel to be kind. Tomorrow, when you're out walking your dog, ask your mate, be honest with me, is my dog overweight? Because I'm afraid we're in a pet obesity epidemic. We have around about 68% of our pets are considered overweight, if not obese. It is a huge welfare issue. And because it's so prevalent, we've forgotten what dogs should look like. Now, this is this bad that when I go dog walking now, if I see a dog that is the right way, I kind of get ecstatic and have to go and tell them, oh my God, your dog is a waistline. That's amazing. So number 9 is get your dog down to the right weight, and don't be scared to ask your friends for the truth, because we don't want any walking coffee tables. Number 8 is the same thing on the food side of things. There really isn't huge amounts of evidence that one kind of diet is superior to the other. I'm hoping to secure Marge Chandler to come and join us soon, who is a really, really well-respected nutritionist, veterinary nutritionist, so she can answer more of these questions for us. But it's not about the food as such. I want you guys to think about how you feed. No one ever said dogs need to be fed in a bowl. They can be fed in interactive feeders. In the last few weeks with Holly, I used to put one kibble in a piece of newspaper or a piece of paper and screw it up, and she would have 30 to 40 balls of newspaper that she could tear up to get her food. Kept her mind busy, kept her active, kept her moving. You can use your feeding to help you with activity and mental stimulation, and it can make you feel better. So that's number 8. Number 7, the weather's changing. It's getting cold. And what happens when you get cold? You start to tense up. Your shoulders come up, your back gets tight. You're like, oh, that doesn't feel very nice. Now imagine if those joints were sore. Imagine if all the soft tissue around these joints and around the rest of the body had been compensating and was tight and was spasming. And then you add cold into it. That's going to make it just so much worse. So please keep your dogs wrapped up. There's some brilliant coats out there now. Don't get sucked into trendy. Get sucked into functional. So furry hoods and trims and bows and glitter, make sure that they're warm and they cover the areas that need covering. I'm really afraid that I don't like these coats that leave the back end open. You know, they've got this kind of jacket around the chest. What about the hips? We know that the hips, the lower back really is a common place of problems. So make sure that that coat covers all the way over. So that's number 7, I believe. Number 6, just get the foundations in place at home. I say this all the time. Slippery floors, slippery floors, slippery floors. I am blunt. You will get used to seeing a rug on your floor. You will not get used to losing your dog. And that is the truth. And if putting a rug down and stopping your dog having lots of little slip is going to make a massive difference to their pain states and the progression of the disease. If you've got painful hips, you're going to have weak hips. You're not going to have the ability to cope with little slips. Dogs' pads, they're not suction cups. They're not like Spider-Man. They don't offer grip. They're there to cope with the different surfaces that we put them under. So they're really hyper-keratinized pads. They don't offer good grip. So that's flooring. That's number 7. Number 6, walking. I tend to tell people to walk less than walk more. Yes, I tend to see more palliative care cases. So number 6 for me has to be, don't be scared to rein it back in. I would say that 80% of the cases that I see are over-exercising their dogs. What you'll see is that the areas that are compromised, let's just focus on the back legs again, will start to fatigue. And when they fatigue, because they still want to be out, they still want to be playing, they still want to be having fun, they'll throw their weight forward into the areas that are coping to carry on being out there. But they'll give you subtle signs. The little limp will come back, the back might be stiff, the legs might tremble, they might choose to sit down more, but they're like, oh yeah, I'd quite like to be out still. But look for those subtle signs. You might get the more major signs where actually they do choose to sit down, they don't want to move. You should be home by then. They will get distracted and they want to sniff, 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 and you can't get them back from that distraction. Kind of start making your way home. Think about how long you're walking them for. Don't push them past fatigue and into pain point. If they're in fatigue, they're more likely to hurt themselves. That's number 6. Don't over-exercise. Number 5, think about where you exercise. I see this quite a lot. The owner wants to take the dog somewhere lovely, but then they forget to get to the somewhere lovely. They have to go through the forest of doom to get there. So they have to go across the bridge and down the thing and over the stepping stones and through the gully and over the cliffs and around the sides. And then they suddenly get the lovely place. You're like, now we've got to go all the way back. So think about where you're exercising your dog and make sure that to get to that golden destination, you aren't asking too much of them because you have got to get home. Number 4, then help me, I always lose track. Number 4 for me has to be about car travel as well. It's something that's often overlooked. I have, and in my youth, sat in the back of a car, illegal now, but many years ago, and you have no idea when the next corner is coming. You have no idea when they're going to suddenly brake. And if everything is sore and you are struggling, that is going to be really uncomfortable for you going on these car journeys, even 10, 15-minute ones. So make sure that where you put your dog in the car, they have a cushioned surface to lay on, and make sure that they have got a nice, comfortable cushioning around them that they can press into. Think about the car of the chair, the chair of the car that you're sat in. I hope you're not listening to this. Think of this chair that you're sat now. We push our backs into things to stabilize ourselves. Give our dogs that opportunity to. So make sure that they're safe in the car. When you're driving, give them breaks. If you're going for a long period of time, stop and let them go for little walks. So that was number 4. Number 3, raising the bowls. I see this a lot. And yes, it's not just for comfort levels. So if you have been throwing your weight forward and you've got very overdeveloped musculature in your forelimbs and your neck's really tight and it's all constricted up there, leaning forward to get down to the bowl, you're putting all of that extra weight into that area you can't quite reach. You start spreading your legs to try and get down there and suddenly slip. And I've seen that quite a lot. So you'll see dogs, to get down to their water bowl, they have to widen their front stance, and then they are not very stable and they can easily slip, or they're putting strain through their pecs. So raise the water bowl, make sure there's a tractional surface around it. They become a bit sloppy drinkers, so there can be lots of slip hazards around that. Number 3, what was I 3? Lynn, help me. Number 3, thresholds. This is something that when I used to do my house visits, always owners didn't see thresholds as a problem. Dogs will often do them at speed, they'll jump over them, they'll bunny hop them, and they are a trip hazard. So just consider them. If there are big steps getting down into the garden, then be aware that when you take your dog out, first thing in the morning or last thing at night, those slips and those trips and those falls, especially if they're dark, especially if they're slippery, they can be catastrophic and they can really make your dog's condition a lot worse. Number 2 is going to be the one that gets everybody's back up. I really do think you need to think about the hobbies that you choose to do with your dog. We know that these activities that we do with them are very high arousal. I was playing a game with Luna last night where she had to choose between the chicken, the bear, the skunk, the penguin, and I was trying to get her to learn what each one was. I've got a challenge with Amy. Amy thinks that a dog could remember 80 things. Lou's not got to 2. But she was so excited and running around the house trying to find the penguin and the chicken that she kept slipping on a piece of laminate that I hadn't covered, but it didn't stop her. She was like, yes, I've got to play this game. So the same with ball throwing, frisbee throwing, stick throwing, stone into river throwing. They get really, really excited. They get really into it and all the endorphins going off and they don't feel pain to the same degree at that point. We know that they're in a different state. And when the game is over and when they go home, that's when these soft tissue injuries really do start to show themselves. We also know that we're seeing more catastrophic injuries because of, high intensity ball throwers and dogs jumping in the air and twisting midair and landing badly. So think about these games. And I will always remember a lovely guy called James, he's a vet, and he was telling me about how his dog, he used to always kick the ball for it, and it wasn't until he came back from holiday, I think he'd been away for 3 weeks, and his mother had been looking after his dog, and she didn't have the ability to kick that ball, and that dog's forelimb lameness had gone, and that dog had been on many different treatments, and he realised that his everyday happy activity was actually really aggravating that dog's disease. So think about these hobbies. They might be just short-term happiness. Number 1, the one that I always love, is that we're in this together, guys. Your Dog More Years is not about Project Hannah. It's not about Project Cam. It's about a need to change a global misunderstanding about how animals express pain and our duty of care to do something about it. We all want our dogs to be with us for as long as possible. So what we do need to do is look after them. And these simple things, jumping out of the car, slippery floors, falling down the decking, kicking the ball, are things that don't take very much to change, and they can have a massive impact. They're also things that everybody can do. So let's talk about this disease. Let's tell other people about it. It is the biggest reason that we euthanize pets prematurely. We wish that we had more time to talk about cats. It's a massive killer of cats. It is something that we need to be identifying earlier because it's a welfare issue. This is pain we're talking about. It's our duty of care to make sure that the animals that are in our care are as pain-free as possible. And I say we get years longer if we can identify this disease earlier, get a diagnosis and manage it effectively. Thanks for listening. Sorry that we lost Andy. Sorry, Andy. Next week, we will be back. We're going to be jam-packed for the rest of December and into January. We've got a lot going on. All of these are being ripped from Facebook by the lovely Dawn and put onto our YouTube channel, so they're going to be easier for you to search for. If you've got anything that you want us to talk about, then just tell us and we will do the best we can. If it's controversial stuff, we'll do our best to dig around and get you fact answers, get the evidence out there. Evidence-based medicine, we really proactively support that. So, till next time, ciao for now.